Have you ever caught yourself saying, no worries? Well, I'm Steph.
And I'm Steph, and we have some worries. Hi, everyone. I'm Steph with an F.
And I'm Steph with a PH. And welcome back to Some Worries, the podcast brought to you by two anxious bitches.
Hang out with us while we talk about therapy. In today's episode, therapy stands. So, this is a mental health podcast. We got to talk about therapy, right?
That's right.
Like,
We have
it has to happen.
Yeah.
So, both of us currently go to therapy. Do you want to talk about your journey and like how you got into therapy and, all of that?
Yeah. So I would say my journey was a little bit non-traditional, in the sense that I kind of came at it from the perspective of dealing with some health issues, and that led me into therapy. So those who listen to some of our previous episodes, I think I've mentioned this in our bodies episode. I might have also mentioned some of this in our fitness episode, but I have a chronic illness, and I was seeing a doctor for that. And one of the things they recommended to me, among a plethora of things I've tried, is they said, hey, why don't you try our psychologists who help with these conditions? And it's for GI conditions, digestive conditions. So I saw a GI psychologist, and it was kind of this eye-opening experience for me because I had never been in any kind of a therapy setting before. And I had this person who was helping me kind of understand how to manage the stress I was feeling, both general life stress, which causes symptoms, but also the stress you get when you have symptoms and you don't feel well. So helping me kind of process through all of that. Those sessions were limited. I think I only had like 8 to 10 of those, but they were really great. And I ended up by the end of that time realizing I would probably benefit from therapy. So why don't I see if I can get a therapist? So the psychologist I was working with was great. And she was like, yeah, absolutely, you should. And she kind of helped me get connected with resources to find my therapist that I see now. So it was not something I think I kind of went into the way that everybody does, because I think some people go into it more from that mental health perspective. I didn't realize how anxious I was until I saw that psychologist and we started talking, and I was like, oh shit, I have anxiety. Like it was one of those realizations. This thing that I've had my whole life, I didn't realize I had it, and now I have a name for it, and that name is anxiety. So it was just like this really funny experience of, oh, okay, yeah, I probably should like talk to somebody. And then I did find my current therapist partly because she specializes in people who have chronic illnesses. So she's really great at helping with the anxiety and all of those things. But she also really understands what it's like to be a person with a chronic illness and how that can create extra challenges or extra barriers with all the things you do in your life. So she's fantastic. I mean, that's why this episode is called Therapy Stands, because Steph and I both stan our therapists hardcore. We're super fans.
Yes. And if our therapists are listening to this, which they might be,
We love you.
we stand you guys hardcore.
Yes, definitely. So yeah, that's sort of how I came into therapy. And I'm curious, so Steph, I think your trajectory was a little bit different. So for you, like, what did that journey look like coming into starting therapy?
Yeah. So I also have anxiety
What?
and depression, which
What?
I've talked about many times. I know you're just like shocked. You had no
I
idea.
am shocked. We have been friends for years. How could you not tell me?
As if you could, could we be friends for years and you had no idea? Like,
I know. I honestly think like when I started therapy, I was like, I'm the last person to know I have anxiety. I think is maybe the truth of the
yeah.
matter. I like go into this, appointment and being like, oh, I think I have anxiety. And I'm sure everybody else in my life was like, yeah, bitch, yeah, we know.
Duh.
Yeah.
So I've known that now for a while. I didn't know for like growing up or anything like that,
Hmm.
but I knew for a while, and I was at a point where I was really struggling to manage specifically my anxiety symptoms. And so I went to my regular primary care doctor and like built up the courage to talk about getting on medication for it, which scared me for a really long time because all of the commercials are like all of these horrible side effects.
Yeah, they say them real
And I was
fast,
just
like you
like,
won't notice that it's like loss of loss of all of your limbs. You know, it's like really fast.
Exactly. Yeah, they're all like that.
Yeah.
So I was just like, I don't know, but I built up the courage. I started talking to my doctor about it, and we decided to put me on an anxiety medication. But then she was like, also, have you ever tried therapy? I was like, no, I have not. For a lot of the like misconceptions that we're going to talk about later in the episode, I didn't think that it was right for me. But she was like, I think you should try it. It's a really good idea to try it in conjunction with medication. So she referred me to a therapist, and I actually went through 3 therapists before I found the one that I'm with right now. So it was like kind of like dating,
Yeah.
I guess. But, you go on a couple dates, not really. We're not calling it dates, but you go to a couple of appointments with a therapist and you try them out, and you see how they respond to what you're talking about. You see the kind of like advice that they give you, if they give you advice, exercises, like what you're looking for. And the first therapist I saw was not at all what I was looking for. I actually felt a little awkward, and
Mm,
that's not how you should feel.
yeah.
So I asked my doctor to refer me to another one, because at this time I had insurance that was like, you have to have your primary care doctor
Mm,
refer you before you can
hmm.
go. So she referred me to someone else. I went to a few appointments with that one. I wasn't really vibing with her either. And then she actually ended up leaving. And so it kind of worked out, I guess, a little bit. And her office called me and said, this therapist has left, but we have this other therapist. Would you want us to make an appointment with her? And I was like, sure. And then, like, literally the first appointment with her, I was like, finally, this clicks. Like, she gets me, she gets the way that I talk, and we vibe really well. So now I've been seeing her for a year and a half or so. So yeah, so it's like it can happen a bunch of different ways. Like, you're not always going to click with the very first therapist that you go to.
Yeah. I'm so glad that you're sharing that too, because if there are those listening who maybe you like have tried therapy and you were like, I didn't like my therapist, you can try other ones. You know, I think
Mhm.
you're a good example of that, of finding somebody that you jive with. And that is
Mhm.
important because the therapy should be a safe space and it should feel like a safe space. And so you want to find somebody who you feel like you can connect with and you feel
Right.
comfortable with.
Right.
Yeah.
And yeah, and the first therapist, like I said, I wasn't vibing. I stopped seeing them, and I actually was like, therapy just isn't for me,
Mm,
because it didn't work with that one therapist. And
hmm.
so it took me a couple months before I was like, I really do want to try to find someone before I ask my doctor for another referral. So I know that that is something that a lot of people think, that they go see a therapist and it doesn't work. So therapy is not for you. But that's not true. I think therapy is for literally everyone.
Yeah, definitely.
Everyone.
Yeah. It's just about finding
Yeah.
that right match. And,
Yeah.
and sometimes that just means you might have to try a little bit of speed dating to get there.
Yep.
But yeah.
So I know that this is pretty similar for both of us, I think, but
Hmm.
how did the community where you grew up view therapy, mental
Mm,
health, going to a therapist, medication, maybe, like all
hmm.
of that?
Yeah. I've probably mentioned this in previous episodes, but therapy just wasn't ever something I thought of as an option when I was young, just because in where I grew up, in the community I grew up in, it was more seen as something only for people who had really significant, severe mental health conditions. The only people who go to therapy are people who were, quote unquote, not my words, but the community's words, crazy. It was like you had to be in such a severe state to access therapy, because that those were the only people that needed it. Otherwise, just suck it up. Just kind of deal with it. Everybody gets sad sometimes, or everybody gets worked up about things. Just like that was sort of how it was
Yep.
treated. Yeah.
Yep.
So it took a while for me to realize that it is something for everybody, and that it's not just for people who have really significant mental health issues. Of course, if you are having severe mental health issues, I encourage you to do therapy as well. It can be very supportive, but it's for everybody, regardless of where you are. Even if you don't have a mental health condition, you just want to talk to somebody. about something going on in your life, you can have a therapist. I remember my mind was blown. I met somebody when I was, I don't know, like in grad school, I think, because this was the period of time when I had moved to Boston and I met a lot of people from a lot of different parts of the country and the world. So I was learning about a lot of different new things that I didn't know before that. And I remember talking to this one girl and she was saying like, oh, I think I might go see my therapist. And she said it so casually. And somebody else in the room had asked her like, oh, do you see a therapist often? She's like, oh, just occasionally. I don't do it all the time, but sometimes it's helpful. And she was talking about like when she was a kid, like her parents always made sure she had that available to her if she needed it. And it was just, that was such a different kind of, like, her childhood was so different from what mine was. And I remember being like, whoa, you can do that. Like it was kind of amazing to me. But yeah, I think that where I grew up, it was just really viewed as this thing that was sort of a stopgap measure if you're like in complete turmoil. It was not seen as an easy resource to access for people who might need it. And medication, I mean, that was sort of, again, you only need medication if there's something seriously wrong with you. And if you do need medication, that is a sign there is something seriously wrong with you. And you might also be ostracized by some people in the community. I also grew up around a lot of very religious people, and the thought was that you just pray your problems away. As if that's going to fix everything. Jesus is not an antidepressant. I don't know why these people are out here
I
saying these
want that
things.
on a shirt. Oh my God.
It's
Jesus is
true.
not an antidepressant.
Jesus is not an antidepressant. If you are depressed, go see a therapist. If you want to pray, great, but like that's not going to save your life. You need to go and like find access to care. Like if I broke my leg, I wouldn't just like sit around praying like, "Hey Jesus, can you help me out?" I would go to a fucking hospital. Like mental health is the same
Yes.
thing. So
Yes.
yeah, it was
That's
just
like one of my favorite metaphors for mental health is like
yeah.
if you were to injure yourself physically,
Mm-hmm.
you would go find treatment. Why
Yeah.
does it have to be different for your brain? It
Yeah,
doesn't.
it doesn't. It's no different. So yeah,
Yeah.
that was definitely the community I grew up in. And I know you have very similar experiences. Do you want to talk about that?
Yeah, I mean, I think mine is very similar to that. We both grew up in the South,
Mm-hmm.
and had similar religious people around and other views on mental health. I think also a lot of people just don't understand mental health issues, which is part of the reason why I want to be so vocal about all of the things that I've gone through. Like that friend of yours in grad school that's just
Mm-hmm.
like, I'm going to go see my therapist. Like that's how I try to be with everything too, just really casual.
Yeah.
I'm going to therapy. I am on an antidepressant, like whatever, because that's how it should be. But because a lot of people don't understand, they don't know how to help you through any of the things that you're going through. So
Mm-hmm.
I have probably had anxiety my entire life. And when I would have anxiety symptoms, it would just be like, just calm down. Or, what are you so worked up about? That you said
Mm-hmm.
that earlier. Like, that's a
Yeah.
huge thing. What are you so
Yeah.
worked up about? I don't know. Honestly,
I
my
don't
brain's
know.
just fucked up.
Right. My brain's just going wild right now. I can't tell you.
Exactly.
Yeah.
So it was just like a misunderstood thing and not something that I really understood about myself until probably college and when I started reading more books that dealt with characters that had the same symptoms that I do, which is something I think we talked about in one of our earlier episodes. Like
Yeah.
books opened a whole new like understanding within me.
Mm-hmm.
And so yeah, that was kind of how it was. It was just misunderstood and therefore ostracized like you were talking about. So
Mm-hmm. Yeah.
yeah.
Such a good point. Yeah, it is so funny when like people's, and I think this happens too in wherever you are, whatever community, there can be this misunderstanding of how to handle if like a friend or family member is dealing with some mental health issues. Like sometimes people don't know how to react, and sometimes the first instincts are bad. They're like, just calm down. If you could calm down, you would have. Like that's
Yeah,
not,
that's like literally the worst thing to tell me
yeah.
if I am feeling
Yeah.
anxious.
Well, I like, and
Yeah.
what I think helps too for anybody who might be listening, like, well, what am I supposed to do if somebody is being all anxious around me? Just like be there with the person rather than just trying to fix it because you can't fix it. Just be like, hey, I'm here for you. I'm going to help you get through this. make sure the person is taking deep breaths, drinking some water, doing all of those basic things, just to help them. And if they need to have like additional help and support, help them get that. Maybe make the phone call to their doctor's office or whatever it is if they're in really dire need. But yeah, like being like, just calm down, not helpful.
Yeah. Another thing too, like everything you just said is perfect for anxiety, at least
Yeah.
like for me. But
Yeah. But
if I'm
depression, we can speak
feeling,
to that. Yeah.
yeah, if I'm feeling depressed or in a depressive episode, the thing that is the best for me is just to ask me what I need
Yeah.
versus like, what are you sad about? Which like, fuck that. That question can go die. Um, but like, you know, it depends on how I'm feeling. Like I may want someone to come over and be with me, or I may just want to be left alone.
Hmm.
I may, want someone to keep checking up on me. I may want to just talk on the phone for a little while, or
Hmm.
like we do game nights sometimes when we're feeling sad, or, I just want to be left alone. So like asking someone, what can I do for you? What do you need
Hmm.
is, I think, the biggest, like the most wonderful thing. Like when
Yeah.
someone asks me that when I'm anxious or depressed, I'm just like, this person actually gives a shit about me.
Yeah.
It's nice.
And it's applicable to so many life situations. I mean, it doesn't have to just
Yeah.
apply when somebody is maybe depressed or anxious, but if you see somebody going through anything, just asking what they need, and then
Mhm.
honoring whatever they say. I think that's also important too, because it's easy to assume that you know what somebody needs, but just because you might want a certain outcome in a certain situation, that doesn't mean that that person wants the same things you do. So
Right.
asking is huge. Yeah.
Yeah. Yeah. So we were talking about how a lot of people misunderstand
Mm-hmm.
mental health issues and
Yes.
therapy. So, what are some other misconceptions or myths that you had about therapy before you started going?
Oh man. I mean, I think a big one, and a lot of people have this, which is the like, I don't need therapy sort of talk track that's in people's heads. For
Yeah.
a long time, I just never thought I was a person who needed therapy. And partly because of how I grew up, I saw therapy as something that only people with already diagnosed mental health conditions that were extremely severe needed. And
Mhm.
as I got older, I realized, oh, wait, actually, this might be helpful and kind of cool to try. And then, when
Yeah.
I started having these health issues and saw my doctor, and I saw this great opportunity to actually try it out for myself. And I think I've really learned that you don't have to go into, there's lots of reasons people go into therapy. I mean, we each have a different sort of story of how we got to where we're at. People may just want career advice. You might be like trying to figure out what you want to be when you grow up. Who isn't? Aren't we all? But that might be a big question in your life, or you're trying to decide, how to handle something going on with your family or your friendships. You can just go to a therapist for those sorts of things too. It doesn't have to be like a huge, your life doesn't have to be imploding for you to seek therapy. So yeah, I always used to believe that like I didn't need it, but then I started with therapy and realized how helpful it was and how supportive it was to my life. And I was like, oh no, actually, everybody, like you said, therapy's for everybody. Like I think everybody should have access to this as a resource.
Right.
Yeah. So I mean, do you have any other misconceptions that you've heard about therapy? I know there are a million.
I could talk about misconceptions about therapy for like hours. I think another one that comes to mind is like therapy is only for the weak,
Mm,
or
mhm.
only for people who can't handle life,
Yeah.
which kind of ties into what you were talking about, where it's like only for people who are going through severe mental health
Hmm.
crises, and or only for people who can't handle it. And that's again not true. I think
Hmm.
a lot of these, like all the misconceptions kind of all tie into each other, and
Hmm.
it's all like what we've been talking about, where therapy is only for a certain set of people.
Hmm.
But you don't have to be weak to go to therapy, whatever that even fucking means.
Yeah.
Like Steph said, I mean, just emphasizing what you said, if you could go to therapy and bitch about your coworkers
Yeah.
or like your fucking dog or
Mhm.
whatever,
Whatever
like
you
it,
need. Yeah.
whatever you need.
Yeah.
Yeah.
And I think it's important too to like reframe that, because I think people really do believe that if you are seeking therapy, there it means there's something wrong with you and you are weak. But I think that the strongest people I know are the people who knew that they needed help or sought help and then, were better for it. So I think that there's a
Yes.
real strength in saying, I think I'm going to try therapy and see if it helps me, because you're actually taking steps to help make your life better, and that takes a lot of courage. So whenever people
Mhm.
think that therapy is for the weak, I'm just like, no, I think the opposite. I think
I
therapy is
do
for
too.
strong people, for strong ass
Yeah, you have
bitches.
to be super brave to
Yeah.
go and say like, I think I need help.
Mm-hmm. It's the hardest
Yeah.
thing I think for most people to say or to admit, is that I think I
Hmm.
might need help. And whether that's something as simple as bitching about your coworkers, like I could really use some help dealing with this work issue or whatever, or if it's something a little more serious where you're concerned that maybe you're depressed or anxious or have other things going on, whatever it is, it takes a lot of bravery. So yeah,
Yes.
it's a
Agreed.
total misconception, the idea of weakness being tied to
Yeah.
therapy.
Hmm. You want to do another one?
Yeah, let's do another one. These are fun.
They are
Um,
fun. I could shit talk these
oh my gosh,
misconceptions. Like,
I know.
ugh.
Um, so another one that I think people say a lot is like, why should I have to go to therapy when I can just talk to my friends? And
Yes.
this is one that I think is it's a little more nuanced and complex, because I think if you have a good relationship with friends, that can serve as a support for you, potentially. But there's also such a thing as oversharing or traumatizing your friends with problems that they are not equipped to handle. A therapist is a trained mental health professional who can help you if you are struggling with something. Your friend is somebody you met at a bookstore or wherever, and they may or may not have expertise in what you're going through. You have to
Hmm.
kind of know where to take your various problems. And there also may be people who don't have that kind of a close friendship. And so if you don't have close friends that you can talk to, therapy is also a great option. So whenever people say that, I'm like, are your friends okay with being your therapist? Because
Right.
that's a lot to put on somebody who you claim to
Right.
love.
Right. And I think also like you have to have, like you're saying, you have to have that kind of a relationship. Like you and I, for example, like we
Yeah.
will often tell each other these kind of some of the same things you may be talking to your therapist about, but you may or may not actually get the help that you need to deal with those. It's like
Mm-hmm.
with us, we may vent. I think you and I have like a good understanding so we
Yeah.
can help, but
Yes.
you need to make sure that the friends that you're talking to about this stuff are okay with hearing it. Like
Mm-hmm.
again, you and I as an example, I know that you share these things with me, so I feel okay sharing those things with you. But if it was someone else that I didn't know as well, you would want to make sure that they're okay hearing it,
Mm-hmm.
um, and that they feel comfortable with it. But
Mm-hmm.
like again, you're not going to help me deal with these mental health issues. So that's what a therapist is for. Like they
Yeah.
have the tools, the resources, the energy to help you deal with those things. And that is not usually what friends are good at.
Mm-hmm. Yeah, definitely. Like
If that
friends are
makes sense.
great.
Yeah.
There's nothing wrong with, leaning on your friends if you need to for extra support, but it's you just have to know like sometimes you need a little bit of help and sometimes you need a little extra help. And when you need that extra
Hmm.
help, go to the therapist.
Right.
You want to make sure you have the right tools for the job. And if you just want to vent, great, do that with your friends, but a therapist can give you meaningful advice, can help you see through an issue in a way that you might not be able to see it yourself, in a way that your friends might not be able to see it because they're too close to you and they might not
Hmm.
see it for what it is. So, I mean, having that extra support is huge for sure.
Totally.
Mm-hmm. All right, you want to hit
Yeah.
us with another one? What's another misconception?
Sure. I got another one. So,
Okay.
another one that I hear a lot is if I go to therapy, they're just going to give me medication.
Mm. Yep.
And first of all, therapists, like an actual therapist, can't actually prescribe medication. There
Mm-hmm.
are, is it the psychiatrist that can?
Yeah, a psychiatrist or a
Yeah.
psychologist or a medical doctor, they can prescribe medication, but
but not
Anybody
a
who is
therapist.
not a therapist, yeah, unless they
Right.
also are a psychiatrist, which, you know, sometimes people double dip and have,
Yeah.
you know, both credentials, but most therapists, no, they're not going to prescribe you the medication.
Right.
Mm-hmm.
So that's not going to happen, but also like that's not what they're there for. They may say, "Hey, you might want to talk to your doctor about getting on an anti-anxiety medication if that is what you are in like wanting," but they're never going to force anything on you. And also like you may get on medication before. Like for me, I got on medication before I started going to therapy and then did therapy kind of a little bit after as an added resource for
Mm-hmm.
dealing with the things that I was going through. So you're not going to go to therapy and they're not going to be like, "Hey, here is, Zoloft, fuck off."
Yeah,
Like
here's your requisite treat bag of
yeah.
antidepressants. Like, there you
Here's your
go.
little like
Welcome
pill
kit.
thing of meds.
Yeah.
Um that's not what therapy is for and that's not what you're going to get at therapy, but that was something that I heard a lot before I started going to therapy was like they're just going to push meds on you.
Yeah.
um
Yeah. And a
yeah.
good therapist is going to know there, like therapists meet you where you're at. So like a lot of this fear I think sometimes comes from people being like, well, I don't want to do something I'm not ready for. And if I go in and they say I need medication, I'm not ready for that. That's fine. You can actually have
They
that
know.
conversation with your therapist. Like you can just say like, "Hey, if it comes up, you know, I'm not super comfortable. Can we talk through medication?" Like you can have that can be a whole conversation for a therapy session or two,
Mhm.
to talk through your comfort level. And your therapist will help you figure out if medication is not something that you're ready to try. They'll help you come up with other things you can do in the interim to see if they help. You know, they're never going to force you to do anything you don't want to do. They're really just there to help. So yeah, it is funny though. The I do like the idea of getting like a little treat bag, and when you get there, like kind of at the
Yeah.
dentist where you get like the little toothbrush and the
Yeah.
floss.
It's like a little sampler of like a few
Yeah,
different
they give you
medications.
like a
Yeah.
whole little assortment there.
Yeah.
I mean that'd be fun, I
I think
guess.
tied into what you were just saying too, that I don't know if we have on our list of misconceptions, but is like your therapist cannot force you to do anything.
Mm-hmm.
Everything that you're going to get in therapy is a recommendation
Mm-hmm.
of like, here is something that you can try.
Mm-hmm.
If they even do that. I mean, some
Yeah.
therapists don't even do that. They are literally just there to listen and be a sounding board. But if they do give you something, it's just like, you could try this
Mm-hmm.
and you could or you don't.
Yeah.
So,
Yeah.
yeah, I think that that kind of ties into all of it. Like, therapy is just there to help you, not
Mm-hmm.
force you to do anything.
Definitely. And
You got another
another,
one?
yeah, I got another one.
Okay.
I think we both have heard this a lot. The idea that like I can't go to therapy because I just don't have anything serious enough to talk about.
Hmm.
Which I also believed for a long time.
Yeah, me
My
too.
problems are not big enough for therapy. I also felt like if I decided to do therapy, I was taking a spot away from a person who needed it more, and that
Yep.
that was rude.
Hmm.
Yeah, you're nodding your head, you know.
Oh yeah,
Um,
I had these exact
yes,
same thoughts.
these were like all of my fears with it was that I didn't want to take a space away from somebody who needed it more. I didn't think my problems were that big of a deal. Um, and then I ended up going to therapy. I remember having this conversation with my therapist of feeling like, you know, I remember like my first appointment with her being like, well, you know, my issues aren't like that bad. Like really, I'm just looking for like a little bit of support. It's nothing major. And she's like, it's fine. Calm down. Like it, whatever. Even if it is major, it doesn't matter. I think I just thought that like I had to come in the middle of an absolute crisis in order to access this care. But no, you can just go whenever you're ready and whatever that means for you.
Hmm.
And then I also got there. This is the fun thing. So sometimes you're like, I don't need that much help. And then you just start talking about things and you're like, well, shit, that has been impacting me a lot. And I have been doing those things over and over again. And I would like to change that about my life. You start to like uncover things, not to say that you go in and like find all of these problems, but you start to uncover things about yourself. They're like, oh, I hadn't thought of that. And I actually do want to fix that. You know, it kind of helps you to see things from that different vantage point, like you were talking about. Like your therapist can see things a little bit differently because they have a bit of a different perspective. And so I actually ended up feeling more like I belong here the more I did therapy, because I started to realize, like, yes, even if I didn't have big problems, no big deal, but also there are things I can work on, and that's okay too. So I would encourage anybody who thinks that they don't have big enough problems for therapy, don't let that be the thing that stops you, because you can always go for a session or two, and if it's just not feeling right and you're like, I don't think I need this, you just stop going. Nobody will be upset about that. But it's worse for you to not go if you really could benefit from it.
Mhm. Totally.
Mm-hmm.
So another one that I have, which kind of ties into what you were just saying, is that therapy is a one and done
Oh,
activity.
yeah. Mm-hmm.
So like you do have something you want to talk about, or you are having some kind of issue, and you go in and you go for one or two sessions, and then it's like, boom, cured.
Cured.
And you never have to go to therapy ever again for the rest of your life because you're just perfect and happy, which
Yes.
is a crock of shit. Some people do have a specific thing that they're dealing with,
Mm-hmm.
and they will go to therapy, but it's never going to be one or two sessions. Like I think kind of standard is like 8 to 10 sessions to deal with something. But even after those 10 sessions, if you feel like you've worked through whatever that issue is, it's not over. Like
Mm-hmm.
I view therapy as a long game.
Yeah.
It's like you you're a human being alive on this fucking planet. You are probably going to continue having things that come up
Yes.
for the rest of your life.
Mm-hmm.
So it's not something that you're just going to like be cured of
Mm-hmm.
in one or two sessions. So yeah, I always think that that's funny where like you kind of see that in movies and TV
Yeah.
sometimes where it's like I'm just going to go to therapy for a couple sessions and then they're happy, and it's like
Yeah.
no,
That's not how that works.
that is not how that works.
No. Yeah, it is definitely a long-term relationship.
Yeah,
And you have the
because like
right.
to your point, like
Mhm.
you're going to keep finding things
Yeah.
that you could work on because
Hmm.
again, we're human. So
Yeah.
you're going to go and you're going to start talking about one thing that's probably going to bring up something else, that is
Hmm.
going to bring up something else that's going to tie back to the first thing.
Yeah.
It just keeps going.
Yeah. And there's different seasons of your life too, where the issues that you're dealing with in like one part of your life, you may get through those really well, but then,
Hmm.
in a few years, you're in a different part of your life and you have these new challenges and you're like, oh crap, how do I deal with those? I've never seen those before. So I
Right?
think like having a therapist kind of in your back pocket is a good
Totally.
way to just make sure you have that support no matter what life is going to throw at you. Like, that you have one person in your corner who you can connect with and they will help you through it. And
Right.
I think that's what therapy provides. Yes, it can provide the short term if you're doing those quick sessions, but I think for many people the therapy is just a part of your life, the same way that you and I know, make like fitness a part of our lives. And like it's just a part of your lifestyle that you can decide to
Right.
have to be supportive.
Yeah, and it can be
Mhm.
as often or as like
Yeah.
what's the word? What's the opposite of often?
Yeah, what is the opposite? Less frequently?
That seems so weird,
Less
but
frequent? I don't know.
yeah,
Yeah.
so you could be going once a week for 6 months, and then you
Mhm.
start going once a month. Then you
Yeah.
start going every other month. Then you go back to going every week. Like that's what I did. I was
Yeah.
going once a week when I first started, and I was going for once a week for a while, and then I went down to a month, once a month
Mhm.
because I didn't I wasn't like as in that situation anymore, but I still
Mhm.
wanted to go. But now I'm back to once a week or every 2 weeks, not once a
Yeah.
week, every 2 weeks. So it's like it's totally flexible and it works with whatever you're going through.
Yeah. I mean, I'm
I could
kind of
talk about
similar.
how much I love therapy forever.
I know, me too. I mean, I have a similar setup too, where like I go, when I started out, I also went once a week. And I think a lot of therapists will start you out there because they want to
Hmm.
get to know you and they want to see where you're at and they want to learn more about like what it is you want to accomplish. And then a good
Right.
therapist is going to help you figure out like, okay, does that mean we need to continue to meet every week? Can we do every other? Is there a different state of amount of time that makes sense. And so I usually go, now I'm like every other for the most part. Sometimes we'll go like 3 weeks in between.
Hmm.
But whenever I'm going through anything that feels like a bit much, I won't even have to say it in the appointment. We'll be at the end of the appointment and we're scheduling our next one. And she's like, I think we should go ahead and meet next week. And I'm like, okay. And she's always like, it doesn't mean you're sliding. It doesn't mean that there's anything bad happening. It's just, I think you could probably benefit from having a little support next week with everything that's been going on. And I'm like, thank you.
Right.
I appreciate that.
That's awesome. I'm glad that she can like read that in you.
Yeah.
That's awesome.
Yeah. And I mean, I think that's when you get to know somebody really well in therapy, like you can have that kind of relationship. But even if you don't, like your therapist should ask you, like, how do you feel? Like, do you want to meet, every other or every 3 weeks or every week? Like, what is it you want?
Hmm.
Because to your point earlier, they're not going to force you to do something you don't want to do.
Right.
It's
It's
all
for
you.
you.
You're the
Yeah.
driver's seat. Yeah,
Yes.
for sure.
Yeah.
Yeah.
Do you have another misconception?
There's so many, so
I
many.
know, me too.
Another one that I think people say a lot, that I've heard people say, is they think that therapy is going to just make them feel worse. And
Mm.
this is another question or misconception, I suppose, that is nuanced because I think there's some variability.
Yeah.
I think the idea that outright just going to therapy on the whole is going to make you feel worse, I would say that's probably false. I think for many people, going to therapy is very helpful and supportive, and especially if you're going when you already aren't feeling great, you have nowhere to go but up. So you might as well give it a shot.
Facts.
It's just, you might as well try. And for some people, if you're starting out therapy, your first few sessions, if you're going through something really hard and you're having to confront that with a therapist, and again, this is all up to you whether you decide to do this or not. But if you're like, no, I really want to face this, you may have a few weeks where you're feeling all of those feelings a lot stronger than normal because you've decided to address them. But on the whole, you should start to feel better the more that you are kind of staying in touch with your feelings and processing them, because therapy is
Hmm.
great for helping to process whatever it is you're going through. So anytime people say that, like, oh, it's just going to make me feel worse, I mean, it's one of those hard things where I can't tell you if after your first session you're going to come outside and it's going to be like sunshine and rainbows. Maybe it will be, maybe it won't, but you will feel better. And it's like you said, a long con here. Like it's a long game. You want to try to get through a period of time where you're working through your issues, and then you will feel better. So I wouldn't ever tell somebody not to do it because they might have to feel sad sometimes. That's life, baby. Like if you just didn't do things because
Yep.
you might be sad, what are you doing on this planet? It's it's still an important and useful resource.
Yes. Agreed.
Mhm.
Another one that I have is that therapy is too expensive
Mm,
because
yeah,
I feel like TV and movies, man, they just like screw up misconceptions
yeah.
for a lot of things.
Hmm.
And therapy in movies and TV, it's always like hundreds of dollars a session, things like that. And I mean, therapy can be like that, but
Hmm.
if you have insurance, most of the time, therapy is going to be at least partially covered. It could be that you have to pay like a regular doctor copay. It may actually be free depending on your insurance. It may be partially covered, but insurance does help with therapy. Of course, if you don't have insurance, it can be really expensive, but we do have some recommendations later for how you can access therapy if you don't have the resources to get to it.
Yeah. I think it's very personal, much like most things to do with therapy. It depends on your situation, like yeah, what your insurance is, what that setup is. But yeah, if you have insurance, for the most part, services tend to be covered, and at the very least with a referral. Sometimes you don't need a referral at all. It just depends on your insurance plan and where you're at. There are also doctors who will provide like lower cost mental health services or therapists. So you can sometimes look in your local community and see who those people are. Or sometimes they'll offer sort of like a discounted rate for anybody who's not insured. So if there's a therapist you're interested in seeing, you can always ask about those options, because I think a lot of them are sensitive to the fact that access is important and that access can be difficult if you're uninsured. So if you're uninsured, it doesn't hurt to look into that and to see if maybe it's an option. But as Steph said, we'll have some other resources of things you can try for free, places you can go. We'll talk more about that later. But yeah, I think if you have insurance, and it's kind of like going to any other specialist, it's often
Mm-hmm.
covered. So it might be less expensive than you think it is.
Yes, exactly.
Mm-hmm.
Okay, so when we started going to therapy and we were like, these misconceptions are a bunch of bullshit. What surprised you most about therapy once you started going?
I think for me, the most surprising thing, being a person who went in feeling like, I don't know if my problems are big enough for therapy. I don't know. Going in and then realizing the power of having a person to be your support through life who is not attached to the other people in your life. They can see things really clearly in a way that you can't, because we can't see we see everything through our perspective and through our brains. And there's no way that you can get around that. And another person who is objective to your reality can help point things out that you don't see. The power of having somebody like that in my life is huge. And just the fact that
That
like
is literally the best part of therapy.
it's the
This
best
right
part.
here. It's the best.
Yes. And the greatest thing too is that therapists meet you where you're at, which so many of the misconceptions we talked about are people being afraid of being pushed too far too soon, or being asked to do things they're uncomfortable with, or feeling like it's not for them because XYZ. But a therapist is going to meet you wherever you are. Whatever comfort level you have with therapy as a concept, you start there, and you can kind of expand whenever you're comfortable. If you're the kind of person who goes into therapy and you're like, I want to talk about all of my trauma, your therapist is gonna be like, great, let's go. If you're the person who's like, I just kind of want to talk about my day, I want to start there, your therapist will be like, great, no problem. Like whatever it is that you need to deal with, they will meet you there. And I think there is
Mhm.
just so much value in having that in your life, because that's a service that, as much as you may love your friends, they can't provide for you. And this is somebody who is trained to be really good at that. So that was, I think, the biggest kind of surprise that I had, was how much I love it and how useful it is, especially as
Mhm.
a person going in thinking like, oh, I don't need this.
Yeah. Yeah, I think the thing that surprised me really ties into yours is that there is a therapist that works for you. Like I said earlier, like I went through a couple before I found my current therapist, and I I didn't feel like the therapist was meeting me where I was.
Mm,
Like it was just, the first one was kind of awkward. The second one, just like I just didn't vibe well with them.
mm-hmm,
And once I found my current therapist, that's exactly what I got out of her. And it is like completely life changing, because having someone who is impartial, doesn't know anyone else in your life except for you,
mm-hmm,
and to like your point, they can get into your brain and kind of help you see things in ways that you're not seeing it. And so one thing that like my therapist does is I'll be talking and I will kind of be getting to something that I need to say or hear, but it's like I can't get myself there. And she's like, bang, bang, bang. And she's like makes me stop and realize what I'm saying. And I'm like, oh shit. I didn't see it like that before because I'm in my own brain.
yeah.
Um, and it's funny that you should mention like someone finding you where you are and helping you with what you are currently comfortable with. Because that happened to me. My therapist, when we were first seeing each other, it wasn't like completely surface level. We were
Mm-hmm,
dealing with like some things that I was going through that I needed to work through, but it wasn't as deep as it is now. And
mm-hmm,
so we kind of like were just getting into things for a little while because I wasn't really comfortable with talking through as deeply, but now I am. And so it's like she's meeting me where I am and we can
yeah.
talk about what you're comfortable with. No one is ever going to force you to like, it's not like you're going to sit in your first therapy session and they're going to be like, so tell me about your childhood.
Right.
Which is what like movies and TV shows make
Yeah.
it out to be. It's
It's like,
like
tell me about your
the
relationship with your mother. Tell me about your
exactly.
relationship with your father. They tell us everything
Exactly.
about your personality. Yeah, it's not like that.
Exactly. And like that's not how it's going to be. Like if
No.
your first few months you just need to go in there and like talk about your coworkers or your
Mhm.
relationship or whatever, like that's fine.
Mhm.
But if you do want to immediately dive in, like you said, stuff like
Mhm.
they're there for you.
They're there.
Therapy is you are in the driver's seat. I think you said that earlier, and that's
Mhm.
like a good metaphor. It's like
Yeah.
you get to do what you want to do in therapy.
Yeah.
But yeah, so there is a therapist for you. It may take a little while to find them, but they're
Mhm.
there.
Definitely.
Yeah. So to that kind of point, my therapist has taught me a lot of shit. I'm sure your therapist has taught me a
Mhm.
lot.
Yep.
Is there anything that yours has taught you that you think other people might benefit from?
Yeah. A really big one, and this is might sound obvious to people listening. It wasn't obvious to me before starting therapy. So, if hopefully this will be helpful for people to hear, but I don't. I think I went into therapy not fully understanding um, how to handle emotions, and I kind of went in thinking, okay, I've got anxiety. I know that. Maybe there's like a little bit of stuff I could talk about at some point when we get there when I'm comfortable. But that's we'll handle that, and then like I'll feel good, and then maybe I won't need therapy anymore, and I'll be like great, and I'll be really happy, and things will be perfect. And I think going through the process of therapy, I've learned one, that emotions are with us forever. And there's something that we deal with forever because we're people who have feelings. But also, like, you
What?
can't just, I know, right? Mind blowing. This
Damn
podcast
it.
just hits you with the hard truths. That's what we're here to do. But I thought that
Uh,
like I was just that's the key to being happy. I've learned that in order to like feel happy in your life, it's not going to be an absence of negative emotions. It's going to be you adding things to your life that help you feel joy and happiness day to day, and helping that to balance out the other feelings that you have, because life is all of the emotions. Our experience is all of these emotions, and they are all valid, and they are all part of who we are. So you can't just expect to like go into therapy, talk about some of the things that bother you, then you're like perfect and happy forever. You have
it's
to,
not one and done.
it's not one and done. It's not one and done. And you also have to, not in addition to talking about the things in therapy that maybe are bothering you, therapy is a great way to explore, how do I bring more happiness into my life? How do I get more joy into my life? What are activities I like doing? Therapists are great at helping you with both of those things and to find that balance. So, like, learning that emotions are about balance and finding balance, that was something that I really had to learn through the process of therapy. So, for those listening, I hope that's helpful if that's not something you've thought about before. I feel like probably other people know this, and I just was really late to this party, but it is helpful to think in that context.
It is.
Yeah.
Balance is such a good word,
Yeah.
just in all areas of life. Yeah.
Gotta have balance.
Yeah. So one of mine, I'm going to start with a really simple thing
Okay.
um, that I think people probably have heard this as well, but it's just the five senses.
Mm.
So something that you can do when I'm doing an exercise. Steph was doing like
Yeah.
a big existential kind of thing, and mine's just like a little tiny exercise, but
That's all right.
whatever.
It's all right. No, I have some exercises too. So those
Okay.
listening, we made some lists before this because we knew we could talk about this topic until the end of time, and we tried to like list some things that we thought would be helpful. So it's going to be a mix. Like some of it will be existential crap, like I just said. Some of it's going to be actual things you can use, like a exercise. Take it away,
Yeah.
Steph. That is actually going to help people more than my ramblings.
I don't think so. So both of us are anxious people, and there's a lot of anxious people out there. And something that you can do when you feel those symptoms starting to bubble up is just the five senses. So that means, like, say you're in your office working and you're feeling anxious, you just kind of sit there and you use each of your five senses, and you can either say it out loud or just say it in your head. So, like, I see my bookshelves, I hear the traffic, I smell my coffee, I taste my coffee, and I feel like something that you feel. So I feel Freddie in my lap. Um, and you can keep doing that over and over until you feel better, or you can spend time with each of those 5 things. So, like, if I was saying I hear the traffic outside, like, I can sit here for 30 seconds just listening to the traffic go by. If I say I feel Freddie in my lap, like, I can sit here and pet him and feel the weight of him in my lap and do each of those things, and that kind of triggers your brain into calming down. There's some scientific thing for it,
That's for therapists
where,
to
like,
know.
it
Yes.
yeah, it's like it's an actual scientific thing that, like,
Yeah.
it triggers, like, a change in your body and in your brain. I don't know
Mhm.
science, I'm not a therapist, but, it's a really good exercise, and it's so simple.
Mhm. Yeah, that's great. I mean, another exercise that I had, which not surprising if anybody's listened to any of our other episodes, well, I'm a big meditation person. So mindfulness is really helpful and doesn't have to be meditation. It can be meditation if that's something you're interested in. But what you just described as 5 senses, that's a form of mindfulness, which is where you're bringing yourself into the present moment and trying to be focused on what's here and now in this moment. And it's really helpful for anxiety because I know like a little, I've been told a little bit of the science. I'm not an expert, but essentially, when you are in a state of high anxiety, you've triggered a fight or flight reflex. You're into that. There's like kind of 2 states that our bodies operate under. There's like fight or flight, and then there is our what we call rest and digest in the GI psych community, which is where I learned a lot of these techniques. But
Mhm.
you have sort of those 2 modes, and if you are in this heightened state, you want to try to bring yourself back to rest or digest. And there's lots of ways you can do that. And the 5 senses, mindfulness is one way to help you get into your body and to help kind of override that immediate like fight or flight response you're having as a result of the anxiety. And it also can be very calming and can help you feel just more in control of your environment. And so mindfulness is great however you want to do it. That can be wherever you are, just taking a moment to sit, get in touch with your senses. You could people watch if you're out and about and you just want to sort of take a moment and be like, what's around me? Here are these people. I love that dress she's wearing. It's a pretty color. You can just kind of look at your environment and just feel like you're a part of the environment and have that kind of sense moment. Another thing that I find really helpful for me, and this one might require the help of a therapist to be fully effective, but you can try some of these techniques on your own without a therapist. It's called cognitive behavioral therapy. And really, cognitive behavioral therapy is recognizing when you have thoughts that are popping up that are problematic. So, if I don't know, a really good example, I use cognitive behavioral therapy to help with some of my digestion problems. So, I would have immediate reactions to not feeling well, and it would be like panic things like, what if there's not a bathroom? Like that would be like a thought that might immediately pop up. And so when that happens and you don't check that thought, you're just going to immediately get yourself worked up, like worried about what if there isn't a bathroom where I'm at and I get sick, blah, blah, blah. But cognitive behavioral therapy teaches you to take that thought and to actually engage with it and say, okay, if there's not, here's what I'm going to do. And you can like build this, you can almost like do a worksheet of all of your thoughts that are problematic, and you can build alternate responses to those thoughts. This is where I say it might be helpful if you have a therapist to really like dive into it, because there's like workbooks you can try. But the whole premise is just challenging your thoughts. Because also you might have thoughts that aren't true. You might think that person doesn't like me, might not be true. And you can like take a moment and decide, is that a true thought? Do I know that for sure? Did they say that to me? Am I just assuming that because I'm feeling nervous about talking to them? You can like break that down and it can help kind of unravel some of those stickier thoughts. So, kind of the combination of mindfulness and cognitive behavioral therapy are both really good tools. Um, but again, look it up, get some resources, get some help if you need help doing that. But I find it really helpful.
That plays into the one of the ones that I have, which is, the rule book. So, this is something that my therapist gave me relatively recently. It's an
Mhm.
exercise where you've gone through a traumatic event, or you've gone through an abusive relationship, or you've gone through like something that has really affected you and changed you as a person. You write down on one side the rules that you're currently operating under.
Mm.
So, and this is going to be the things that that traumatic event or that relationship or whatever has taught you and made you operate under. So, say, you were in an abusive relationship, and so now you don't trust anyone. So that's, you write that down. You write down like personality traits, you write down things that you do in certain situations. And then on the other side, you write down who you want to be, the roles that you want to be operating under. Instead of not trusting people, like having good conversations with people to open yourself up to trusting them, whatever. You write those
Mhm.
things down. And then you are just cognitive of those things. So when you are in a conversation with someone new, you can recognize like maybe you're putting up a barrier because you don't trust people. And so
Mhm.
you can kind of like, as you're doing those things, work towards not doing that when you're talking to someone. Say like a personality trait that you currently have now is like you're shy. So, but you want to be more outgoing. You can put yourself in situations where you would be more outgoing and just be cognizant of the fact that that's where you want to be going. And
Mhm.
yes, you may have to like force yourself sometimes to do those things, but that's kind of how it works. So I really like that a lot, that rule book of like, here's what I'm currently doing that I
Yeah.
don't like about myself, and here's where I want to be. And to that, something that kind of goes into that is like sticky notes. This is
Mm.
very simple. But say one of the things that you do, or one of the reactions that you get physically is during work meetings, and you know that that is going to happen in an upcoming work meeting. You just like know because of the situation or what the meeting is or the team, you're going to have a certain reaction. You just take a sticky note. You can write something as simple as like breathe on it and put it up where you can see it during that meeting. Or you can write down the actual rule that you want to be operating under and say like, this is how I want to respond to this situation, and also put that up so when you're in the meeting it's like in your eyesight. And if you start to feel those things build up, you can just look at that sticky note and go, I don't need to react this way, like this is
Mhm.
because of an anxiety or because of a past thing that I dealt with. So yeah,
Yeah. I
I
love
like that
that.
one a lot. That's something that I've been working on for the past couple months, and it's a good one.
Yeah, I love that. I had a sticky note for a while that I kept when I was working on my book. I went through a period of time where I deal with perfectionism as one of my personality issues that I'm constantly working on. And so as a writer, that can be really paralyzing because you feel like if I don't do it well, what's the point of doing it? I had that issue a lot. So sometimes when I would start to try to draft my book, I would just kind of sit there and stare at the screen like unable to start because I was too worried about putting something that wasn't good on the page. But like you have to start somewhere, right? One of the things I did is I wrote a sticky note and I just said, "Don't be precious about it," and I just like would tack it up, and it was like the nicest reminder every time I had to write it. Be like, okay, I'm gonna stop like acting like this is a big deal. We are not curing cancer. We are just like writing about some fantasy stuff. Doesn't matter if it's perfect in the first draft, and that like helped me get through that. So another example of a place where you could use a sticky note in your life if you're also a perfectionist, put a sticky note reminding you not to make things precious because that's helpful too.
I like that.
Yeah,
Don't make this precious,
that's right.
or don't be precious about it. Yeah,
Don't be
I like
precious
that. I
about
might
it.
have to use that.
It's like I probably could have phrased it kinder to myself. I think like now I probably would pick something like it's okay, to make mistakes, or like, nothing has to be perfect. I would probably put something a little more gentler, but at the
So now
time,
we have two merch shirts for ourselves. Jesus is not an antidepressant, and don't be precious.
and don't be precious about it. Look at that. The merch writes itself.
It does.
Oh my gosh.
Oh, that's amazing. Okay, so we have a good amount of exercises that we've learned, but are there
Mhm.
other resources that you would recommend to people who maybe want to learn more about therapy or how therapy and mental health coexist?
Yeah, I think my number one resource share for today is a YouTube channel called Therapy in a Nutshell. It is a fantastic channel. It is run by a licensed therapist, and she has all of these videos breaking down various mental health topics. She even has like a 30 video series of how to process your emotions, and she takes you step by step.
Really?
Yeah, this
Ooh,
channel
I
is
need to look
incredible
this up.
stuff. It's amazing. Her name's Emma McAdams. She is just, her channel is just incredible. So if you haven't been there, go check it out. Um, Whatever you might be dealing with, there's a video for it. She has videos about if you're dealing with insomnia or depression or anxiety. But that like 30 video series of processing your emotions is also very good. And she gives you all of these really actionable tips. And so this is especially great if you're somebody who either can't access therapy services at this point in time due to there not being enough providers in your area, or if there are cost issues that prevent you from accessing that. This is actually kind of a great stopgap resource if you want to learn more about these topics and maybe try to practice some of them. I think she does also offer different like educational things too. I think there's a small charge for some of those, but it's sort of like keep the lights on charges. She's not out here like charging you hundreds of dollars and stuff. But she does offer some more in-depth things that you could do where you get more face-to-face interaction with her if that's something you're interested in. But her videos are all free and just fantastic. So check her out. I'll put the link in our show notes too for those who might want to click over and check that out.
Nice.
Mhm.
I have not ever watched any of her videos, but now I need to go do that
You
because that
should.
sounds amazing.
She's great. She has so many good ones.
That's cool. So one that I want to mention is also a podcast. I want to preface this by saying both of us are white people, white ladies.
Quite twice, yes.
And so we have had a certain relationship with therapy and access that some other people might not be able to have. So if you are looking for resources more targeted to your community or who you are, we're aware that therapy is super personal. Everyone has needs that might not be addressed by certain therapists. So we highly recommend trying to find a therapist that is knowledgeable about your community, whether that's race, religion, sexuality, etc. But one podcast that I wanted to talk about that I have actually listened to, despite not being a Black woman, is Therapy for Black Girls. It is run by Dr. Joy Bradford, and she is also a licensed psychologist, and she is passionate about making therapy and mental health resources more accessible, specifically to Black women. But she uses a lot of like pop culture references to make therapy more understandable, which I think is really cool. So she's on all of the podcast platforms just like we are. And I think she also has a YouTube channel. So
Ooh.
highly recommend hers. We'll link that in the show notes as well as some other resources for people who don't look like us.
Yes. Yeah. I appreciate you bringing that up, Steph, because I think that's yeah. I'm just glad you brought it up because we can only share our experience, and there's a wide diversity of experiences that they're not in our lane, and they're not things that we're going to be able to help with. So yes, we will definitely put that in the show notes for those who would benefit from that additional resource. Also, I just want to check that out. That sounds really cool. Just the like all the pop
It
culture
is, and
references
she's
and stuff.
great.
Yeah,
Yeah,
that sounds like so much fun. I'm gonna have to listen to that too.
yeah. So do we want to talk about a few other ways that people can access therapy, other resources that they can use?
Yeah, I think like for people who are listening and you're like, all right, you sold us. We're gonna do therapy now. How do we do it? Um,
Mhm.
we have a bit of a list for you of some things that you can try. The first one I'm going to recommend is Psychology Today. This is how I found my therapist. If you go onto their website, there is a section. It's like, I think it says like find a therapist. It's kind of in the top navigation on the side, but you can go in there and you can search in your local area any psychologists, psychiatrists, licensed therapist, anything you need, you can search using their site. And you can even factor in things like if you're looking specifically for help with anxiety or depression. I was looking for somebody who knew chronic illness, and that's a checkbox that you can click on the search and you can filter by all of these different requirements. You can also look at people and see, does their identity match with my identity? Do they look like they would be sensitive to issues for my community? There are additional filters you can kind of use to figure that out. And you can like look at their profile, and a lot of them will have a little bit about like what they do and who they work with, and how best to reach them. So I highly recommend that if you're just like looking for somebody, you can start there and kind of just see what's available. And that's again how I found my therapist, and it's been a great fit. So yeah, that's my number one.
That's cool. I wish that I would have
Yeah.
used that.
Well, if you need another
Um,
therapist,
yeah,
but I mean, I know you love your therapist forever, but if
I do.
anything were
I
to
do.
happen and you needed a new one,
Yeah.
there you go.
Well, another thing that I don't think we really mentioned is that, therapists uh tend to like have certain topics that they're really good at discussing, but maybe
Yeah.
not some others. And you can change therapists if
Hmm.
something new were to come up in your life and you're now looking to delve more into sexuality or a
Hmm.
new relationship. Like you can find therapists who kind of specialize. So that's a
Yeah.
really cool resource.
It's
I
great.
found my therapist just as a referral from my doctor,
That's great
like I
too.
mentioned earlier. So
Mhm.
she referred me to one, didn't work with that. She referred me to another one, and doctors will be kind of knowledgeable about some of the therapists in their area that they've had good interactions with or that patients have had good interactions with. So that's a good place to start as well, just talking to your doctor. And I know it's really hard, but you just got to bring it up.
Yeah. Well, in some doctors' offices now too, I don't, not all are doing this, but I know more and more. Like I went to the doctor this year just for like my annual physical, and they had this questionnaire at the beginning that was asking about
Mhm.
all kinds of, yeah, you're shaking your head, you must have got this too, where they ask
Yep.
about all kinds of other factors of health. So it's not just being like, what are your symptoms, or like, do you have any health conditions? It's also like, can you afford food? Do you have transportation? Do you have access to all of these different resources? Do you feel safe at home? They have like these questionnaires now that they give you to kind of narrow down if there are any areas they can help you. And sometimes there's also questions about mental health. So that can be
Mhm.
a way, if you are kind of nervous to bring it up, if you kind of put it in the questionnaire at ahead of time when you're checking in, that'll prompt the doctor maybe to ask you about it, and then you can have that conversation. So yeah, definitely take advantage of that if you're nervous about it. Sometimes it's
Yeah.
easier just to write it on a form and to just like wait for them to bring it up.
That is a good point.
Yeah.
Yes. You got another one?
I do. So this one would be for anybody who might need access and they can't go through their doctor. For instance, maybe they don't have a primary care doctor. I would say you could check out some of your community mental health resources. Most communities have some kind of a department or an office, and often it's through like the health department where they provide community mental health care. So you can look for those in your local community, and they often offer either free or low cost options for seeking support. They can help potentially to refer you to a therapist in the area if you're having a hard time finding somebody. This can especially be helpful for people who are part of marginalized communities who may not know how to find somebody who understands what they're going through. So sometimes
Mhm.
community mental health can be a great resource. For that, you just kind of have to do a Google search on your own for your local area. You can just search whatever your city is, community mental health, and see what pops up. There will usually be some great services provided. So, highly recommend that as well. And then, do you
Yes.
have another one to share?
Yeah, on kind of on that note, this is not going to be true of everyone, but some workplaces will have resources like this, where they have access to mental health resources. My last job and my current job both have anonymous platforms where you can go and you can get 3 to 5 free therapist calls throughout the year. And it's completely anonymous. Your work is never going to know who is accessing that resource or not. So that's something that you can look at, or, pay attention to any HR documents that you may get. But one that I wanted to mention too is talking to your friends,
Oh, yeah.
just asking, like, hey, I'm
Hmm.
looking for a therapist and I know that you go to therapy, or I've heard I've heard that, there's some good therapists in the area, things like that. Just
Mhm.
ask someone, and if they have a good therapist, then, they're going to be open to sharing that person with you.
Yeah. Yeah, I think additionally too, somebody could try if none of these options are working for you, or maybe if you have a really specific issue you're going through, you can also look for support groups in your area too, especially if you look sort of within whatever your health systems are. A lot of times there are support groups for people who might have different diagnoses of different illnesses. And the same is true for mental health conditions. So you may be able to find like a depression support group or a bipolar support group or whatever it is you might need kind of within your local community. And that can be another space to either like talk about what you're going through with some like-minded folks who are going through similar things, but they can also help connect you too, because those folks probably have met with some therapists and they can help give you some recommendations of where to go. And often the facilitators are also psychiatrists, psychologists, therapists. They can help you kind of help match you to places that they think might be a good fit for you. So that's another potential option.
Yeah. On that note, I would just be very careful to read all of the information about those support groups and make sure that they are from licensed people or people who are, educated in those areas. I won't go into it on the podcast unless you guys comment and you want me to in like a bonus
It's
episode.
a good story. It's a good
It's a
story.
good story. I recently went to a meeting for a support group, and it was no bueno. It was not a good
It was
experience.
not as advertised, we'll
It
say.
was
Well,
not as
sort
advertised.
of.
So just make sure you know, do a little research, I guess.
Yeah.
Look at what they're saying.
Yeah. See who's facilitating it. Make sure they're like a legitimate mental health professional.
Oh man, that
Oh,
was
that's funny.
interesting.
That's
Yeah.
I hope people comment and ask for the story because I love it. It's fantastic. Um Not that I want to force you to talk about it if you don't want to, but it's very funny. So
I mean, it was hilarious.
it's
I
great.
would talk about it again. And
Fantastic.
then another red flag that I kind of wanted to raise too is there are a lot of websites that will have therapists that you can reach out to, but make sure you kind of read the reviews for those websites. There is a website you may have heard of called BetterHelp, which
Hmm.
is really terrible and has really bad business practices dealing with therapists. And
Hmm.
I would not recommend finding a therapist through them. I love Steph's Psychology Today recommendation. I mean,
Yeah,
it's free
it's
to find a
free. You don't have to
therapist and then
pay.
reach out to
Hmm.
the therapist that you find.
Hmm.
So, just be a little skeptical sometimes when
Hmm.
you're reading about support groups, reading about therapists, etc.
Yeah. If you're doing kind of your own online thing or yeah, trying to find a support group, always do a little bit of legwork on that to make sure that it's the company is doing ethical practices and that you're going to get the experience that you want to get out of it. And do that beforehand if you can, because it it just kind of sucks to think that you found a solution and then for it to not work out. And I think that's where some people get stuck sometimes is they're like, well, then therapy isn't for me. And sometimes it might just mean that the option you tried wasn't the right one. So, yeah, do that research ahead of time just to make sure that what you're signing up for is what it's supposed to be and is not a bait and
Yes.
switch. Yeah.
Facts.
Facts. True facts of truth.
So, thank you so much for tuning in today. Hopefully, you found us preaching the gospel of therapy to be helpful.
Preach it.
Preach it. Don't forget to follow us on Instagram and TikTok at Some Worries Pod. If you liked this episode, we would really love if you gave us a like or rated us 5 stars, depending on whatever platform you're on. And we would love if you subscribed. So until next time, we have been Steph.
And Steph. And Steph and I have to go get back to creating all that fan art we have for our therapist. So see you later, guys.
Bye.
Bye.